Hey everyone, and welcome to MediByte. Today we're going to tackle a topic you've probably heard about in the news, a serious but thankfully rare infection called mucormycosis, better known by its nickname, the black fungus.
I mean, that's a pretty scary thought, right? A dangerous fungus just lurking in the air we breathe? It's an idea that's caused a ton of anxiety, so let's cut through the noise and get straight to the facts.
So, the proper medical term for this thing is mucormycosis. It's an infection that's caused by a group of molds. And get this, these molds are incredibly common. They're found basically everywhere in our environment.
Okay, but here is the single most important thing I want you to hear right up front. It almost never infects healthy people. So in this explainer, we're going to break down what this fungus actually is, how it works, and most importantly, who is really at risk.
All right, first up, let's get to know the culprit here. We're talking about fungi that are, and I mean this literally, hiding in plain sight.
And this is what's so wild. Look at where these molds hang out. We're not talking about some rare, exotic superpathogen. Nope, they live in everyday places like soil, decaying leaves, compost piles, and yep, even on that old bread in the back of your pantry.
The reality is, you've probably breathed in these spores like a dozen times just on your way to work today. We all do all the time. But, and this is the key, for a person with a healthy, functioning immune system, these spores are completely harmless. Your body's defenses just take care of them, and you never even know they were there.
So you see, the fungus isn't really the problem. It's always there. The real variable is a person's immune system. And that brings us to the most critical question of all. Who is actually vulnerable?
This is what we call an opportunistic infection. It basically waits for an opportunity for the body's defenses to be down. The people at the highest risk have very specific, serious health issues. Uncontrolled diabetes is a huge one. So are conditions like leukemia that weaken the immune system. It's not just diseases either. Using certain medications like high-dose steroids or a specific drug called deferoxamine can also open the door for this infection.
Okay, so for that small group of vulnerable people, how does a mold that's basically everywhere suddenly turn into this dangerous invader? Let's take a look at how this infection actually takes hold.
And this is where it gets really nasty. The fungus isn't just a surface-level problem. It's incredibly aggressive. It literally invades arteries. When that happens, blood clots start to form, which then blocks off blood flow. And when tissue can't get blood, it can't get oxygen, so it dies. That dead tissue is what turns black, which is exactly where the infection gets its scary nickname.
Now, the infection can show up in a few different ways, and it all depends on how the spores got into the body. The most common type actually starts in the nose and sinuses, from just breathing it in. Then there's a version that hits the lungs, and, less often, it can get in through a break in the skin, like a burn or a deep cut. As you can see, each one comes with its own set of pretty severe symptoms.
The really terrifying thing about that sinus form, the one doctors call rhino-orbital cerebral mucormycosis, is just how fast and far it can spread. From the sinuses, it can push right into the eye socket, causing vision loss, and from there, it can even invade the brain. And once it's in the brain, well, the consequences are just catastrophic.
So you can imagine, with an infection this aggressive, the medical response has to be lightning fast. It is, without a doubt, a race against time.
Yeah, there's literally no time to waste. To confirm a diagnosis, doctors have to take a tissue sample directly from the infected area. They'll look at it under a microscope or try to grow the fungus in a lab. We also have modern PCR tests that can spot the fungus's DNA, and imaging like CT scans is crucial for seeing just how deep the damage goes.
When it comes to treatment, it's a full-on, two-pronged attack, and you absolutely need both. On one hand, patients get hit with high doses of really powerful antifungal drugs through an IV, something like amphotericin B, to fight the fungus throughout the body. At the very same time, surgeons have to go in and aggressively cut out all of the infected and dead tissue. It's the only way to physically stop it from spreading.
And really, there's a third piece to this whole puzzle you can't ignore. You have to tackle the original problem that made the person vulnerable in the first place. So for a patient with uncontrolled diabetes, for example, getting their blood sugar under control is a critical part of giving their body a fighting chance.
All right, so what's the prognosis? It's really important to be honest about how serious this is and to pull together the key things we all need to remember.
There's absolutely no way to sugarcoat this. Mucormycosis is a massive medical emergency.
And the outcomes honestly reflect that. Even when doctors do everything right, we're talking aggressive surgery and the best antifungal meds, this infection is still fatal for a lot of people. It just moves so incredibly fast that it can be impossible to get ahead of it.
And for the people who do survive, the battle leaves scars. The surgery needed to save their life is often extensive and can be incredibly disfiguring, especially when the infection is on the face. It just hammers home why catching this thing early is so critical. Okay, so let's boil this all down to the 4 things you absolutely need to remember. First, this is caused by a super common mold, not some scary new superbug. Second, if you have a healthy immune system, your risk is practically 0. Third, the real danger is for people with very specific and serious underlying health conditions. And fourth, for that small group of people, immediate and aggressive medical treatment is their only shot at survival.
And that brings us to the final and maybe most important point. The fear shouldn't be about the mold in the air. It's been there forever and isn't going anywhere. The real focus, the thing that actually matters, should be on managing the health conditions that turn a harmless mold into a deadly threat. That's where real prevention starts.
Thank you so much for watching this MediBytes explainer. We really hope this has clarified the facts about mucormycosis. If you found this information helpful, do us a favor and hit that like button. Share it with others who might benefit from this information. And of course, subscribe to MediByte for more clear, reliable health explainers. We'll see you next time.